Army College of Dentistry, Secunderabad. Dr. Mamta has completed a BDS and MDS from the Government Dental College, Ahmedabad in the year 2002. She has more than 20 years of experience as a clinician, an undergraduate and postgraduate teacher, and also as a developmental leader and an administrator. She is a keen academician with numerous national and international publications to her credit. She is also a peer reviewer for 5 prestigious journals. She is the editor of the Journal of Army College of Dental Sciences, also the academic editor of the British Journal of Medicine and Medical Research. She is also the founder editor of the IACDE newsletter Pins and Posts, and also the founder administrator for the National Clinical Registry for Root Canal Anatomy. Dr. Mamta is the recipient of the IACDE Award for Academic Excellence in the year 2018. And as she says, the future unfolds her unwavering vision to bring education and learning as an art from which we should bring up the name and standing of the nation in areas of research and quality dental care. With these few words, I hand it over to Dr. Mamta.
Thank you so much, Dr. Arvind. Ma'am, can I start sharing my screen?
Yes, please, go ahead.
Of SRM, Dr. Rajkumar, and everybody for organizing such a vital webinar altogether, the Faculty Development Program. And thank you so much for inviting me to talk on this. When I was asked first to talk on it, I was like, oh my God, Maha ma'am has asked me to talk on it. Let me not let her down. And when I started preparing for this presentation, and I was like, oh my God, ma'am has asked me to talk on this, and I will let her down. So I did read a lot about this. I worked hard on it, and I discovered that there's so much to question paper setting, which we do not know about. So when generally we are asked to set a question paper, what we do is we open the previous year's question papers, look at them, and try and pick out the best. So what we need to understand basically is why are we setting a paper? So basic education, medical education aims at producing a physician who we would like to see if we are sick. We want to visit this doctor when we are not feeling well. And that's what we are all headed towards. So when, as a university overall, as a dental council, as a government, and especially as faculty where we are teaching, it is our responsibility to guarantee that the medical education program is running at a very high quality, and the product produced out of this is properly trained, properly efficient, and correctly evaluated when they are passing out from here. So it is our basic education program, which has a curriculum and a teaching learning process. And then we have to have excellent methods of evaluation, which are current, which are relevant, and which cannot be contested upon. They have to be continuously developed also. So what happens here is that our evaluation method has to be a very high quality. Why does it have to be of a high quality? What is it actually producing to us? What is it actually going to help us doing a medical evaluation? So what happens is when there is an assessment, you have a feedback. It helps you with your ranking also. It helps you when you have a good percentage, you get good rankings. Okay, but it also gives you a feedback to improve your curriculum, to improve your teaching learning if you have to, and it also helps you in improving the instruction delivery. So if I go into undergraduate exam, so if my students have not answered a particular question properly, that means somewhere when I was teaching them, they have not understood how to reproduce. How to reproduce this correctly. So somewhere I need to go back and improve on my instruction delivery method. So that's how the whole evaluation, education, and the whole assessment process works. So it's very important that our tool of assessment is really nice, is very accurate and relevant. So we have to, because ultimately we are giving a product which is worthy or not. And this worthiness is decided by your question paper. So what are we basically assessing? Whether our student has the basic knowledge, he has the skill or higher cognitive skills. So skills are assessed, of course, by your oral and practical exams, but the cognitive aspect of a student is assessed by the written exam. So in written or in our assessment, we have formal education, formative assessment, and summative assessments. In our formative assessments, we have various types of, when we're in school, we think that the formative assessment is basically your internal assessment, but that's not the fact. A formative assessment is a continuous, ungraded, feedback-based system. So in MDS curriculum, what is our formative assessment? We have DCI laid down model checklist for our journal clubs, for our case presentations, for our library dissertations, monthly evaluation of a student, where we are grading the students, we're giving them a feedback. Is this getting accumulated in our final exams? No. So it's basically the marks which we are generating over there are only giving us a feedback. So that's actually a part of the formative assessment. It doesn't really play a role. There are a lot of nations abroad where, of course, the faculty who is teaching or the HOD has a huge role to play in your assignment, your assessment, and your grading. Doesn't happen. So we are very objective, thankfully, in India, thankfully or not thankfully. I don't know whether it's a right thing or a wrong thing, so I won't judge there. But our summative assessment is totally objective. There is no bias. There is no subjectivity when you're coming to doing a summative assessment. That is your question paper based. DCI has divided your question paper, so there is no scope. We are not deemed universities. Deemed universities, like Kritika was telling yesterday, have a lot of scope of playing around with your assessment method. So they have multiple choices. Unfortunately, we do not have that scope, but we do have a scope in our question papers. We can do long essays, we can do short essays. You see the quantum of short essays, the 10 markers are so many. So we are assessing students on 10 markers so many times. So each question can be split into multiple, where you get a scope of scoring the child separately or giving a scope to the student to write better. So end of the term, your MDS exam paper is a totally fixed pattern. You cannot play around with it. You follow this. You've been asked to set a question paper. Instead of opening the previous year's question papers, open the syllabus, open the DCI curriculum. So you know what are your marks and your grading. So I will not go into that again. What is important is your syllabus. Over here, if you look at the star at the end, it says the topics assigned to different papers are evaluated under those sections. However, it's not very strict. They can be overlapping. So students have to be prepared for everything. Very important that we open the syllabus. Applied anatomy, applied physiology, not routine physiology, applied physiology, pathology. There are topics given over here. We need to look at this and make sure that our question paper is evenly balanced. We cannot be going on to our whims and fancies. So when I'm setting a question paper, I am not being judged. I'm not being assessed. Nobody even knows that I set the question paper. Okay, the question paper set by me, evaluated by someone else. So let me be very objective, very not personally involved when I'm setting my question paper. So go through the syllabus. You have to open the syllabus, read the syllabus indicated for part 2, paper 1, part 2, paper 2, and likewise your essay, which are descriptive and analyzing type of questions. This is very important and critical that we open this, because a lot of times we see that there are certain questions which are repeated from other places. Every course, like your MDS course, has a COPO outline. Ma'am, we also did NAC recently, so we had COPO mapping done for entire syllabus from second year, third year, fourth year, and PGs. And DCI also maps this into knowledge, skills, and human values. So these are basically our 3 domains of learning: the cognitive, affective, and your psychomotor. So what your question paper does is assesses only the knowledge part of it. So I'll briefly outline the course program outcomes we put in our syllabus. So in your program outcome, at the end of the year, the student should be able to describe etiology, pathophysiology, diagnosis, management, trauma, pulpal pathosis, and also demonstrate the understanding of basic sciences. They should also be able to master differential diagnosis, recognize different conditions. Okay, they should have the ability to teach and guide. That, of course, is judged by their teaching lectures. But these are your basic knowledge outcomes which have to be assessed by your question paper. The skills and the human value aspect comes totally into a personal level. In the practicals, however, our affective domain is not really assessed. So we're not really assessing how the student is behaving with the patient, how are they introducing, are they following ethical practices or not. We have to teach those also. And we should have methods of assessing them. There are different methods, there are different tools for assessing these, the OSCEs, OSPs and all. They actually analyze how you're conducting, but the question paper doesn't do this. We should introduce that in your practicals. There are three main domains of learning: the cognitive, the affective, and the psychomotor. Like I said, the knowledge, the skills, and the human values and ethics. That's all coming under the affective domain. What we're focusing on today is the cognitive domain, which comes under various taxonomies. Bloom's taxonomy is what we'll be discussing today. The Rathwohl's and the Harrow's we will not be touching at all. That comes into the entire examination pattern, which can be revamped if we have the freedom to do that. However, I think on a regular basis, we are getting a lot of modifications in our questions. So when we wrote questions, when I wrote my exam, we had 4 exams, 4 questions each, 25 marks in my paper 1, 2, and 3. And paper 4 was essay. Things are better now. You've got short answers to write in 10 marks. So we can actually analyze and cater for a wider syllabus to be covered in the question paper. Likewise, the practicals are also gradually modified to quite an extent. So the Bloom's taxonomy is basically a pyramid. It's starting from the base of the pyramid is formed by your remember, understand, and apply. So that's your base. That's your major bulk of your pyramid. And then when you go tipping up, you're going to analyze, evaluate, and create, where your middle order and your higher order gets assessed. So your basic principle here is to remember, understand, and apply. Earlier, they used to say that create is the tip of the pyramid. However, gradually, they decided that we need to move this. So our base is still the same. We are now an inverted cone, but our remembering, understanding, and applying the knowledge, the analysis, the application, and the understanding is still the base. That's forming the bulk of your analysis. Whereas analyze, evaluate, and create have all come at the same par. So your middle order thinkers and your higher order thinkers are coming into that category, which is right at the top, even now. However, we have to remember the base of the pyramid. Why do we have to remember the base of the pyramid? So these 2 slides are very interesting, where we actually try and understand what knowledge, understanding, and application is. So going by that, recall, remembering, classification, categories, this is all knowledge. So if you're supposed to remember something, you're supposed to remember something. There is no alternative to that. So if you're supposed to remember pulpal diseases, classification of pulpal diseases, you're expected to recall it. You cannot be understanding them. What can you be understanding there? Like, what are the different identifying characteristics of an apple? Likewise, what are the different identifying symptoms or signs which your patient is giving to divide irreversible from irreversible pulpitis, reversible from irreversible pulpitis, and also the application. So is your apple going to prevent or cure vitamin C diseases? Is it going to prevent scurvy? So that's the application of reading about the apples. So when you're reading pulpal diseases, you need to be able to apply that how a pulpal disease is going to affect the patient. How are you going to treat it? So that's all about the application of knowledge, understanding, and application. The analysis, synthesis, and evaluation part goes into the higher order. See, here we're going into what is a healthy recipe, what is an unhealthy recipe. Should I have apples with bananas, or should I not mix apples with bananas? If I bring them together, am I actually messing things up? Okay, what kinds of apple are best for me? So what is actually working out very well? What is not working out very well? Can I create a new recipe altogether, mixing these apples? Can I bring a green apple and a red apple, use them together? So those are all creations, analysis, and evaluation of apples, which comes into higher order thinking. However, we are doing the tool of evaluation, which is your written exam. Okay, the tool of written exam generally, is it replaceable? Can we do something else instead of written exam? I don't think so, because written exams removes any scope of controversy. There is absolutely no way that a student can say that I did not pass this exam because the teacher doesn't like me. No, we asked you a very general objective question paper. There was nothing personal about it. You did not read, you did not pass. Did I ask you a tough question paper? I'll be coming to that next. So your question paper has to be split in such a way that that evades controversy also. So the student should not be able to say, no, this teacher set a tough question paper for me. So thankfully, that's not possible in health universities because we do not know who set the question paper. We do not know who evaluated the question paper. But we also do not want terms and examples and excuses like probably the evaluator was not in a good mood. Probably the evaluator did not know what to look for. So why doesn't the evaluator know what to look for? The evaluator has been assessed by the university. He or she is a totally skilled person. They know what to look for. They only do not know what to look for when our question is vague. When I am asking something and you're thinking that I'm asking something else. And the student, of course, is thinking entirely a third thing. So that's when the evaluation goes wrong. So very important that I ask the question in a good way. Okay, so the questions which are prepared casually will not be reliable at all. They will confuse the student and they're not subjected to quality check. So it's very vital that we have a good quality question paper, and it should be able to assess what the students know and the student also knows how. So we have to have a very structured question paper. How are we going to structure it? If you look at this question, this happens so often with all of us when we are evaluating the exam, because let's write something. So this question is, what is this? The question should have been, identify the fruit in this picture. It cannot be, what is this? When you ask, what is this? You leave a lot of scope to answer. Thankfully, the student has written about the fruit. You could have also written about the popcorn and the cheese lying behind. I'm using the term he. It was he or she could have written any answer. But let's not leave the question vague for the student to play around with. So because that's what they do most of the times. And most of the times because the evaluator is thinking that, okay, the student has made an effort, has written 2 lines in this answer, let me give a 0.5 or a 1 mark here. So if the question was very specific as to identify the fruit and tell the uses of it, or identify why is the fruit very important for our life, or what is it contributing to the nutrition in a human being. So the answer could have been elaborated into 10 points also, instead of being a 1 mark question. So when we're setting our question paper, we will follow these basic 7 steps. The first 4 steps will establish our question paper. They'll give you a foundation to your question paper. And the last 3 steps are your elevation, where you're actually going to refine it and make it even better. So the first thing while setting a question paper is that we design it correctly. The weightage of must know, desirable to know, and nice to know. So the must know is catering to your average student. 70% of your question paper has to be based on must know, because you're not judging me. When I'm setting a tough question paper, I'm not becoming a hero. I'm not becoming more popular. Nobody's identifying, oh, I know so many tough things. No. So it's not about knowing tough things. It's not about setting a tough paper. It's about catering to your average student. Catering to your average student who has the basic skills. Okay, you should be able to judge that this student is capable enough to pass out. Okay, and will be able to deliver decently, will not mess up a patient. Desirable to know and nice to know is your upper cream, so that you can distinguish between an average student and an excellent student. So basically, the question paper is aimed at finding out whether the minimal skills or knowledge is acquired by the student or not. And it also should give you an option of identifying and putting a difficulty level onto a question paper, where your high order thinkers get a chance to prove themselves. So what you have to do is, in the beginning, you can divide it into a table, into your must know, desirable to nice to know, 70, 20, 10, put your marks also. And then we put the Bloom's taxonomy into this table. We put the knowledge, understanding, and application problems over here. And not putting analysis, evaluation, and creation over here, because those can be taken further from your basic question. So if I'm saying 10% of your paper is nice to know, it is not that you will put a short mark question or a short essay, full 10 marks into nice to know. It can be a regular question in which a part of it, like a 10-mark short answer, in that 3 parts could be catering, or 3 marks could be catering for the higher order thinker. So you can actually split your 10 marker into a 3, 4, and 3. So where you're asking a classification, the mechanism of action, and the adverse effects. So if you're thinking that adverse effects is a higher order thinking, you can put 3 marks for that, and 3 marks come into that category. So you do that. Objective skills, of course, are not assessed in our question papers. So we're going to make it into short answers and long answers only. And we go back to the syllabus, and we start putting these into this table. So if I look at a question on direct gold restorations as opposed to a question on dental caries. So does direct gold restoration in the current era, please pardon me, people who are fans of direct gold restorations, but in the current era of student who's passing out, is direct gold restoration a must know for them? And how much of it is a must know as opposed to dental caries? So a dental caries is a must know question. A direct gold restoration, if you're putting in a 10-mark category, your average student will suffer. So why not put direct gold restoration as part of a larger question? So you go direct restorative materials or direct restorations, okay? Enumerate direct restorative materials and then give indications for direct gold restorations, or elaborate about direct gold restoration. So that way you're splitting your question and leaving scope for an average student to clutter in, answer that question instead of saying a curved fruit. He can actually answer the question in a particular fashion. So you do that, you take your syllabus and you give weightage into what you want into must know category here. And even though most of the topics are in must go, they can be subcategorized into desirable to know and nice to know categories. Then you put the topics into your table. You put your topics into your table, your syllabus is split across this table of knowledge, understanding, and application. So if I'm using direct gold restoration, I'm asking for a classification of direct restorative material, it's coming in my knowledge. Okay, or enumerating direct restorative materials are coming in my knowledge. So they're coming in a must-know knowledge. At the same time, the same question, we can go into a desirable, when you're going direct gold restorations, you can go into a desirable to know category there. So your question and your topic can get split into a must know and desirable to know category. So that puts your syllabus here. It covers your syllabus. It categorizes your marking scheme also. That forms the blueprint of your question. After that, you make a model question paper. But every question, I would subject this to every question actually. So you go into your content area or your topic. You go into the form of question. Was that a short answer or a long answer? What's the level of difficulty? How much time do you think a student will spend on this? So thankfully, the MDS question papers are not very lengthy. We have only 7 questions, 25 to long answers and 5 to short answers. So it's not very difficult to subject it to this, provided we're willing to make the time and the effort to do this. And along with that, I mean, we do not have answer keys right now. Obviously, we should not have answer keys. We are expecting our evaluators to be of a higher genre who know what to expect. But let's have a question paper which can have a model answer, points, and the marks for the points. So when we're setting this on our question paper, we are automatically telling the evaluator what we are expecting. So our question paper actually should tell the evaluator what we expected the student to know. And the student should know what we're expecting him or her to know, and they should be able to answer it accordingly. The next, of course, is marking scheme. We do not have much scope over here. There are, of course, different types of questions. You have global questions, you have local questions. Analytical is also called a local questions. You also have MCQs, and there's a whole lot of detail on how to set an MCQ where, your distractors have to be hit 15 times and your regular questions should be hit 30 to 70% of the times. But we don't have scope for that in our MDS at all, in our MDS evaluation. So we have basically your global questions and your local questions. I would put a lot of short answers also in sometimes into local questions. Or sometimes you can merge an objective into your global question. So your global is basically going on what, when, why, explain, describe. Okay, sometimes when you're doing a locally topic, you can go find and talk about it, summarize. Both are asking for information. Your local question can be a part of your longer global question sometimes. So we're done with the basic question paper setting. So we've taken our syllabus, we've put it into various categories of must know, desirable to know, nice to know categories. We have also put the higher order, the model question paper and evaluated each question's difficulty level and edited that. So now comes the final part where we refine our question paper in a pattern where it loses all ambiguities. So when you're refining your question paper, you have to look at it and say, does this test give you the important learning of the outcome? Does this question paper meet your learning outcome? What was your learning outcome? That the student should have adequate knowledge about, etiology, categories, the classifications. Okay, so is it meeting that objective? Is it meeting that learning outcome or not? Does it have clarity of directions? Is the language okay? Is the length fine? Is the difficulty level all right? So a question like this, describe important clinical and metabolic changes that occur in space flight. This is a trivial question for a medical practitioner, an MBBS student who's going to pass out. Space flight, it's not even talking airplane. How many people are going into a space flight? Is this a 25 marker? It's a vague and diffuse topic. It could have come into a higher order learning, okay, where you were going into clinical and metabolical changes with changes in altitudes, high altitude or low altitude. And then you could add a small note in it where you put 3 marks for changes in the space flight. So a topic or a question like this should be avoided. Just because the evaluator read about space flight being somewhere in the syllabus does not make it into the category of your 70%. Likewise, these were short notes asked in my university, and I asked my previous students why they found these stuff. So self-etching primers I thought it was all right for a 10 marker. But then they went into telling me it's not really highlighting anything. We are not able to write much about self-etching primers. When you ask self-etching primers, they're starting with the whole series of bonding agents. When you're asking skirt and collar preparations, there's not much to write. So a final question would have been to ask about secondary retention features and then elaborate on skirts and collars. So what it does is it gives the student a scope and a structure into how to write your answer. Osseointegration, again asked in a question paper of conservative dentistry. It's not in the syllabus. It's not in the syllabus. You've asked it for 10 marks. I agree that a student should know osseointegration. I agree that the student should know implantology. Okay, but does it have to be assessed and evaluated in a question paper, which is subjecting the student to stress and not really necessary? Of course, basic sciences has a lot of it. Microbiology does say acid-fast bacilli or mycobacterium come as part of your syllabus, but it could be a part of a broader question, which would give an average student to answer, a scope to answer, followed by a higher order thinking to write so much more about acid-fast bacilli. So you cannot have rare phenomena or entity coming into that. It's not going to be able to judge the practical or professional ability of the student. So such questions should be avoided. You can make them better. So critically evaluate different objects. I should have masked the KNR University highlight on the top, but pardon me that. Different obturating material with respect to straight and curved root canals. Nice, different obturating materials. So what have the students written here? Are they actually critically evaluating only the different obturating materials? They're going to be writing about how a straight canal is prepared, how a curved canal is assessed, the angle of curvature. It's leaving a lot of scope for a lot of jargon coming in there, which might impress one person, but will not impress the other person at all. Because the question very clearly says different obturating material. What are my different obturating material? I have different obturating techniques. Okay, I have very few obturating materials. Am I going to be using those different obturating materials in curved root canals or straight root canals? How is it different? So instead of different obturating materials, could we have gone with different obturating techniques? Is that what the evaluator was looking for? Was the evaluator looking for different ways to prepare your straight and curved root canals and then various different obturating techniques to be used there? We have no clue. Students have written whatever they've written. The evaluator has done whatever evaluation possible. Okay, tried to give marks over there because the students have written a lot of answers. Likewise, critically evaluate rotary instruments in endodontics. I think is a very good question. It's a 25-mark question, as is the biological properties of luting cements. But when you go back and survey it with your students, they find it very tough to write because it is critical evaluation. Now, critical evaluation is your higher order. Evaluation itself is your higher order terminology. The verb goes into higher order thinking. So can we have modified it into enumerate or, describe different rotary instruments used in endodontics? Okay, discuss their structure and critically evaluate them on their performance or their properties. So that gives the student a more scope to write some stuff. And you split the marking also accordingly. You put it into 15 plus 10 or 15 plus 5 plus 5 or 10 plus 5 plus 10, depending on how you want to evaluate the student. So you split that question so that it gets easier for this student to write. Likewise, biological properties of luting cements, unless you've read Mahaman's book, it's very difficult for anybody to write this answer. So, because everybody will just talk about cytotoxicity overall, generally, as the biological properties. You'll talk about systemic toxicity, which is it so applicable with luting cements for a student to know. Pulpal toxicity, is that so significant with the luting cement for a student to know and then write? So unless you've read that one book, which has a comprehensive data of everything, the question gets a little more difficult to write. So it's not like this question should not exist. It's just that the marking of this question should get better. So that's how you refine your question paper. So you look at the length of your question paper, you look at your marks, you look at the syllabus. It has to be a very clear language. Describe clinical paradigms. I am not here to test English. What does paradigms mean? Paradigm means example or the presentation. So does the student know that paradigm means example, or are you asking for the clinical presentation? So why not use clinical presentation or clinical symptoms or signs? Why not simplify the language that we are using and make it easy for the student to comprehend what you're asking for and then write? The student will write something or the other, but it just puts the child little off. So we're not testing English language here. We are wanting to give a very understandable language for an average student. And again, open-ended questions like write about. You just put a topic. So when you just put a topic, it leaves a lot of scope, like I said previously, for a lot of jargon coming in there, which might impress one reader, but might irritate the other. So when you say that the examiner was in a bad mood, he was in a bad mood because you were writing so much nonsense about something which is not needed. So students like to do that. I have done that in my medicine exam, in my practical exam, where nobody knew the diagnosis of the patient, and you were asked to identify and then tell your clinical findings. So the examiner says, tell your clinical findings. And I, like a smart person that I am, I have taken a very good history. I cannot correlate the medical findings. So I go writing and reading the history in a very smart way, that the patient reported with this. The external said, stop it. I'm asking you the clinical findings. Then I go, yes, sir, pretend to be nervous. And then again, read my beautifully written history over there. Okay, so I am a student who doesn't know the clinical findings. I did try to evaluate the patient. I tried to do everything. Even the resident did not know. The patient had just reported. So anyway, we get away with those things. But then that's not what we're looking for. So let's not be vague. Even though my examiner was not vague, I still try to beat around the bush and get my way out. And that was a practical exam. So he asked me something else. I got away with it. But in a written exam, you cannot be that vague. So let's ask very specific questions with STEM verbs, which get it better. Then eventually, of course, we edit our question paper. The reviewing of the question paper, I will cover a little later. So your refining and editing quotient basically goes into making sure that your mode is valid, reliable, objective, practical, fair, and useful. So what does valid mean? Valid means it's a acceptable, reproducible question paper. Valid means that when I show this question paper to 3 different people, like I do a survey validation, this means the same thing to all 3 people. Okay, it doesn't mean a different thing to A, B, and C. Likewise, a question paper should ask theory. We should not be asking explain the steps. So when we ask a question like non-vital bleaching, so the student starts with writing causes for discoloration, causes. They don't even focus on causes of discoloration of non-vital teeth half the time. And then they go into non-vital bleaching, where you do your obturation, you remove your GP, you put your GIC, then you put your sodium perborate, then you seal it, and then you wait. Okay. And sometimes you do an intracoronal and extracoronal bleaching together. So that's the steps of bleaching. When we ask non-vital bleaching, it gives them scope to write about that. We have not been very specific. What are we expecting? Were we expecting them to write steps of non-vital bleaching? Were we expecting them to write some more about non-vital bleaching? Were we expecting them to write the causes of discoloration in non-vital tooth and how to treat that cause of discoloration? How are your chemicals working? How are they acting? What are the side effects, adverse effects of this chemical? Why you should do and what you should do to prevent that, instead of simply saying the steps, enumerating the steps. So asking a question like explain the steps, this comes in your practicals. Of course, there's a topic which is not getting covered in the practical. You can put it up, but then elaborate on what more are you expecting the student to write about. So a validity of a question paper is very important. Likewise, it should be a very reliable question. So you have to have, you should not have any measurement errors. So the assessor should split the marks into portions where you're able to give. So when there's a question that classify GICs, okay, or write about different types of GICs and setting reaction, I should know that types of GICs carrying 2 marks, okay, and the setting reaction is carrying 3 marks. So if the student has written this and not written that, I should be able to grade the student on 2 marks, not on the entire 5 marks. So likewise, it has to be a very objective paper. It has to be very precise. We cannot be bringing in our personal biases. Okay, it cannot mean something else for me and something else for you. So it has to be very objective. You cannot leave the assessor to apply their own opinion. No, I thought this way. I'm not leaving you a scope of thinking that way. I said this question paper, you should know exactly what I'm expecting without me directly communicating to you. So that's very important here. Likewise, your outcome should be assessed. You should have concurrence from 2 evaluators which are meeting the same requirement. The question like this, find X. What's wrong? We found X. The question should have been find the value of X. Then you would have applied your Pythagoras theorem and then found the value of X. So the question is vague. I know it's exacting. Okay, maybe in mathematics you will write that, but I think the student is brilliant, because how are you going to say this is not X? He's found X for you. So let's get very specific with our questions. Find the value of X, identify the fruit in this picture so that the student is not confused and, doesn't know what you asked for and writes whatever he thinks correct. So likewise, the evaluation paper has to be very, very fair. It should not be changeable by examiners or examinees. You should be able to reproduce this and it should be useful. So when I've done a question paper, there should be some positive impact on learning coming out of there. So the student should have learned by answering that question paper. You learn so much from MCQs. You learn so much from, other kind of formative assessments. So your question paper also should be a learning experience. If you're not learning today, maybe tomorrow you should say, yes, on writing that answer, I should have written this also. And when I was writing that, I learned how to, write my answer properly, and I could remember, recollect, stitch together so many things into that question paper. There are, of course, different types of responses. You have an extended response and you have a restricted response. I prefer to have a restricted response question. Only your essays are extended response question. Over there, you can have the student write whatever, wherever they want, in whatever patterns that they want. So you should be able to understand at the end, the student's understanding, assess their abilities and systematic flow of, their content. Likewise, You should know the student's knowledge. You should know what he knows. You should know what he or she doesn't know. You should be able to judge that also based on your question paper. So we use a lot of action verbs. We'll not use the verb write on. We will use describe, explain. And when we're using analytical questions, we'll go discuss, evaluate, and design. So sometimes we can have speculate on this. So in that, it gives a student a lot of scope of writing many things which they have read about. So these are various, of course, describing words. Not all of them are applicable to us. It's a good slide when ma'am shares this, but you can have, you criticize comes into your evaluating, defend comes into your evaluating, but is demonstrate, identify, explain, discuss, classify, they all come in our understanding. Usually recall and recollect are simple, but most of these verbs are very important for us to apply in our question paper setting. So all questions should have very clear instructions. Like, for example, a question like sodium hypochlorite. Why don't we make it more specific? I mean, when we're going into, of course, undergraduation, we can simply have the role of hypochlorite in endodontics, or you can split it into uses of hypochlorite, mechanism of action. You can actually split it into uses, mechanism, and precautions. You split the whole question into 3 + 4 + 3. So you know that the student has answered for 7, you mark them for 7. Whether they've answered full 7 or not is your judgment, but you mark them at 7 if they've not written the precautions or the adverse effects of sodium hypochlorite. So you can judge and split your question paper like that. It gets easier for the student as well as the evaluator. Then finally, of course, is our checklist. We're coming to this the end of this. So at the end, you do a check whether you've covered the syllabus. You have the full range of abilities for objectives, whether the weightage of the topics has been covered or not, the must know, nice to know, desirable to know. I will keep emphasizing on the Bloom's taxonomy always. Okay, then the appropriate level of difficulties, the questions cannot be too easy or too difficult for an average student. Okay, then discrimination, still we should be able to identify the high order thinkers. It should be comparable. It should be unambiguous. This is the entire checklist. There's no overlap. Sometimes we see that the long answer was part of a large topic and a short answer is based on the same. The long answer is talking about root canal morphology. And in the short answer, you are asking internal anatomy of a mandibular molar. So the students are very confused. They're like, okay, I've written the whole thing there. And as is the evaluator. So there's an overlap of a question. There should not be any overlap. So just run through that checklist, see it once more, show it to a confidant if you can, preferably not to, because you're then violating the confidentiality of the question paper. And of course, the question paper should be comparable to the standards. The time required should be okay. The student should not exit and say too lengthy. They can say, I was not able to manage the time well. You should not say it was too lengthy a question paper. And you should not have repetitions from previous years. So it's nice to open previous years, but do not copy paste from that. The best way to verify a question paper, you cannot do this for a current question paper, bell curve. This is the question paper which was January in our university for undergraduation. And then we plotted the marks which was scored into a bell curve. So if you look at the bell curve, it's tipping a little on the left. This is still a very good question paper because the bell curve is quite even. So if my bell curve tips a lot on the left, it was a tough paper. If it tips a lot on the right, it was an easy paper. So I have to make sure that my bell curve is evenly placed both on the right and left. And that's how you evaluate a question paper. So if you can see any of your university, your college previous year's question papers, read them and then look at the results. Plot it on a bell curve. If you have an evenly spaced out bell curve, then you have a good question paper. So that's how we actually judge a question paper once the results come. Of course, most important is confidentiality. Please do not share your question paper with your PGs. You've set it for another university. The university has trusted you to set this question paper. And if we are going to follow all the things that I have spoken about, we spent a lot of effort setting that question paper. So let's not share it directly with our students or our friends. Maintain the question paper confidentiality, destroy them, follow whatever regulations the university is telling you to do. Of course, and at the conclusion, make sure that your question paper, you can use examples and case studies also. You can have learning objectives there. You do them beforehand whenever you have time, whenever your students are appearing for an exam, whenever you're setting a question paper for people, question papers, use a feedback for the question paper development process. Of course, using multiple choice options is not there for us. But when you're setting a multiple choice question paper, usually they say the distractors should be such that they get hit 15% of the time and the right answer 30 to 70. So your distractors have to be very powerful when you're setting multiple choice questions. Of course, you should pilot test your questions, use a combination of question types if possible. And at the end, that's one of my last slides, you have to be guiding your students slightly into how the answer script should follow. So it should have a structure also. You should answer script. Let's just tell our students to have a opening sequence and an ending. So you have a flow chart or you have your content written in the beginning, and each answer should cover an argument if there is any. There should be a style, there should be a way of presentation and diagrams, and very important that major sources are covered. So when we have our syllabus written for us, not just writing major textbook names is not adequate for an MDS answer script. So we have to make sure that the students at the same time, when they are reading each topic or they're revising each topic, have read the epic or the classic articles which are published with that topic. So when you're doing, say, a topic like calcium hydroxide, you should have all the epic classic publications read or known to you so that you can cite them. You cannot just, skittle through these things. So very important that we train our students also to write answer script properly. And ultimately, we should be able to assess whether the product was worthy or not. It's all in our hands by setting a worthy question paper, which is befitting the average student and, of course, benefiting our middle and higher order thinkers. Thank you so much. Ma'am, I'm done. Yes. I can take questions if there are any.
Thank you, Dr. Mamta, for simplifying a real complex or the art of question paper setting.
People should not say have complicated a simple question paper setting. Yes. So.
Simplifying the whole thing. Anyway, Dr. Mamta, there's a question from Dr. Sanjeev Yadav, where he feels he's asking, isn't it better, at least in the practical, where we can ask the students to give an exercise wherein the candidates are asked to know how to manage a certain condition rather than restrict them a fixed dogma of prefixed exercises. Where he gives an example, whether we can ask a student how to manage a class 2 dental caries, so on. And he feels, he's asking whether the practical exam should be on the candidate skills and the training rather than on a fixed exercise.
No, the question papers cannot be set on your practical training. Your practical exams are set for that. You have 2 exercises on long case discussions in your practicals. So you have your practical 3 practical exercises which have to be conducted. So theory is only about checking the theory of the patient. You could have examples and case studies which have to be written about, but you cannot go management of class 2 dental caries. That becomes very vague for a student to answer. Because when you're talking class 2 dental caries, you're expecting the student to write about, and you go, okay, if you're asking management of class 2 dental caries, it's okay, but it can't be explain the steps in restoring a class 2 cavity. Management, of course, can be there because then you will have whether you're deciding on the type of restorative material, the extent of the decay, whether you're doing a direct restoration or indirect restoration. So management can be a question, but write the steps on class 2 cavity restoration cannot be a question for a postgraduate because that goes into explaining the steps which have to come in your practical. The student has to know the skill of going step by step. So then this becomes a vague question. So if you could, get more specific into, classify dental caries and write about management of class 2 dental decay. So that's where the student can go into different types of restorative material depending on the extent of the cavity. So those questions can be asked management, but it would be better to spread this out.
I have one question, or rather a sort of a discussion on this. When we evaluate, for example, essay, so short questions, we are having it a structured short question. When it is a essay, for example, a 50-mark essay, like 2 essays at the end of the, in that, whenever I've evaluated, I have a set saying that these are all the things to be included. So when we start correcting one question paper, like we have these many, so everything is included in that. Now again, another, we check another student's answer. There are even those are there, part of those are there, but part of something else also is there, which is also equally important. So we end up, not knowing how much to give each, like, there is always some sort of a mismatch,
Yes.
I would say. By the end of the, when we go to the 8th student, like there is so much ambiguity in my giving the marks. So it becomes very difficult for the examiner then to evaluate the paper.
Yes, I agree there, ma'am. This is the first person advantage and the first person disadvantage which comes into play here. Because when we're starting to evaluate, we're doing it with a fixed mind. So that's why if we spread out our question paper, instead of leaving with just one question, if we did...
Dr. Sarjeev, can you please mute your microphone? Yeah, please go ahead.
So that is where, ma'am, splitting your question paper will help. So when we split our question paper, we know that these are the points which are expected to write. It doesn't happen in a 50 marker. 50 markers are more on analysis and descriptions. So
we cannot split up a 50 mark.
We cannot split up a 50 marker.
See, like ceramics, for example. So, right, somebody writes the basics very well, and advanced means a lot. We're not very the same. So we have to, in our mind, we'll have to create a sort of split up for the marks that is to be allotted.
No, ma'am,
biased on our part also. So how do we?
When we are taking a question like ceramics, we go into define or describe dental ceramics, classify them, write about recent advances and clinical applications. If we split our question that way, there is a lot of scope for the student to answer in a correct manner and the evaluator to see, okay, they had asked recent advances, the student has not covered recent advances. There's still a lot of play area where you go, the CAD CAM and the press ceramics, we can still write about it, but your basic 4 portions are covered. So in your mind, you can split your answering scheme into those in a 50 marker. It's always tricky with the 50 markers. I did not touch that too much, because those are the analysis and the descriptive type of questions. Yes, it's tricky with the 50 markers.
25 mark question still we can structure it properly and we can still ask them. This is where.
Yes. But ma'am, 50 markers also we should split into at least certain requirements, and our students need to know that when there is a 50 marker, it is mandatory for us to write recent advances and applications.
Correct.
So that if we can groom our students into writing applications, it will help the evaluator in assessing better. But there are a lot of times, like you say, once you've evaluated a paper and you're going to the paper 2 and the paper 3 and a paper 4, sometimes you're so disappointed with the answer scripts that you want to go back to paper 1 and give them better marks. But you're already done with that. Paper 1, we go with very high expectations. So there is the first person disadvantage which comes into play over there. It's a tricky area. So that is when our question paper framing, which is in a better fashion, even the long answer, if it is a slightly more elaborated in the question, it will help in the answering abilities.
Dr. Mamta.
Yes, sir.
Thank you for a very student-friendly and student-oriented lecture. We have been highlighted with so many points, I'm very sure. My question was pertaining onto the practicals. The patient will not come to us and tell us do a class 2 gold restoration. He will come with a problem, that he will come with a problem of his signs and symptoms will be symptoms of the food impaction in class 2. Will it not be better to train the student at least in the practicals? Patient will come with stomach ache, he will not come and tell to me appendix. The question was oriented towards this angle because
Sir,
we train one minute. Because if you train your student for a fixed exercise, all 3 years he will be doing only class 2, he will do access opening till molar opening, he will be doing only that post and pod, at least in the last 6 months. So if we keep the question like this, management of class 2 lesion, management of edentulous jaw, management of angles class 2 malocclusion, he can make a myos appliance, he can the functional appliance depending on his interpretation and his skill. That's what the only question I've raised.
So that is what I said, that when you say management of a class 2 DK, you can put it up, but it's better to split that question into various categories. So I was saying, like, if you say management of class 2 DK, it leaves a lot of scope for the students to say, talk about the extent of the
it's
DK.
only for the practical. It's only for the practicals. I'm speaking about anything about theory.
My
What you have
topic
stood
was
about
question
theory
paper
is
setting,
perfect.
sir.
Yes, I know.
Out of syllabus question, sir. Out of syllabus question.
You are training the trainers, madam.
These are practicals
Dr.
for
Sajid,
everyone.
can I answer this question? The correct, you said very aptly that we need to judge the student's ability to manage a patient, right? But unfortunately, that becomes a little more subjective. It cannot be objective in nature because one patient may have multiple problems. The patient may not be cooperative. So their evaluation criteria depends upon the patient, how he responds. So that is the reason why they have kept certain exercises that we have to do for them to have a more objective evaluation. So unless and until the dental council thinks about this, and we'll have to represent it to the council and see if they can do anything about that. Correct. So
thank you, madam.
yeah, I understand.
There is the introduction of long case discussion. No, 2 case discussions are introduced in the practical now.
Yes, ma'am.
There are 20 marks for case discussion. So that's where this aspect is covered for. Unfortunately, whether we agree with the marking scheme or not is of course our choice, but they have been introduced in the system all right. So gradually, I think little by little changes are happening.
See, madam, even out of syllabus you are answering.
Sir, आपके ज़माने में जो right था, मेरे ज़माने में जो right है, and current ज़माने में things are very different. So there is a change in generation. We need to cope up with that.
Thank you, madam.
Yeah, Dr. Arvind.
I think we can close the session, ma'am.
Yes, you can sum up.
I must congratulate Dr. Mahalakshmi ma'am for conceptualizing such a innovative program, and again Dr. Mamta for simplifying the whole thing. And it's actually eye-opener because so many of us set question papers. No, it is eye-opener in a way in which we should set a question paper rather than making it tough for the students, taking them towards the answer. It was real eye-opener. And once again, I thank Mahalakshmi ma'am for having me over. Thank you, ma'am.
Thank you so much. Thank you, Dr. Mamta, for that wonderful session on question paper setting, which is really difficult. And I hope that now, from now on, because we get question papers we do not know from every faculty from around the country. So sometimes we do find difficult that the students find it difficult to answer an university exam paper. So this presentation will definitely help the faculty members to prepare questions in a more structured manner. And Dr. Arvind, thank you very much for moderating the session. Our appreciations to you in spite of your busy schedule. And hopefully we will learn much more in the coming lectures as well, as much as we have learned so far.
I'm sorry to interrupt you, ma'am. There's one more question from Dr. Vinuta.
Oh, okay. Please go ahead.
Dr. Mamta, Dr. Vinuta wants to know, should the examiners be provided with a checklist during paper correction as well?
Yes, I had thought about it, that there should be a checklist when I put up that model question paper, that the points you're expecting. But then if we do that, anybody can check the answer script. So we have to set up our question paper in such a way that the examiner does not need a checklist. So if you're splitting your question paper into correctly, if it's a very balanced question paper, the examiner will not need a checklist. And if we do a checklist for the examiner, are we not, judging the examiner too much also? So we have to leave a little space for the examiner to answer. And then plus your question paper answer scripts are all recorded. So there is scope of re-evaluation or revisiting there. If you feel, if the student feels that he's answered well and the evaluator did not do a good job, there's always scope of going back and looking at the question paper and answer script. So checklist is a great idea. I did think about it when I wrote the points you're expecting in answer, but then at the same time, I negated it because that time we are probably judging the evaluator that they're thinking differently. So we have to be all on this platform, hence this program by ma'am.